thank you all for being here, and then of course a really sincere thanks to kind of inviting me back into this space to talk about some things that we're working on that I'm pretty excited about. This program is sponsored by and presented on behalf of Lilly USA. It is being presented consistent with FDA guidelines. It is not approved for any kind of continuing education. For questions that relate to this topic, I will respond during the program. Other questions, including any product-related questions, will be answered individually after the conclusion of the program with appropriate medical follow-up. The program that we're going to talk about is called the Think, Talk, Treat Migraine program. It really is more of an advocacy program than anything. And it involves a partnership not just with people with migraine, but also with providers who treat migraine, regardless of whether or not that's what they do. So, for instance, primary care providers in particular. You're going to see this slide 3 times during the talk, and for those of you that know my colleague Rob Nicholson, he's a very well-known psychologist in the migraine space, and he's also at Lilly now, and he thought that it was important to show this slide a few times because this is really the central theme of what we're trying to do with our program. So Think, Talk, Treat Migraine, or T3 as we lovingly refer to it sometimes. It's about 3 things. Right? Not just thinking, talking, and treating migraine, but it's really about the 411 of migraine, getting providers and people with migraine to recognize 3 things. 4 key symptoms. So when it comes to reaching people that don't yet realize they have migraine, and there's a lot of people out there that that have what they think of as just headaches, or they think they have sinus headache, or they think they have, you see other terms like sick headaches. I had my, a mother who, she would get sick headaches and she would just be out for the day. And the word migraine never comes up. And so what we're hoping to do is get people to latch on to 4 important symptoms, and that's headache with either an impact on your ability to function, light sensitivity, or nausea, and the relationship of those things with migraine, and recognizing that migraine is not just a headache, but headache is very likely migraine once it starts to impact your life. The key question that we talk about, so this is the one, is how many days a month does migraine impact your life? And that's a question that we don't share with our providers very much, and providers are not necessarily great at asking. And so that was meant to be the one thing to tie this all together so that a provider can activate their knowledge base and understand that they're working with someone with migraine. And then one key answer, and that's really about how often is migraine impacting your life? Is it 1 day or more a month? And if so, are we open to maybe exploring some treatment possibilities? So that's a very long rundown of what 411 is. You'll see that slide again, but I won't spend as much time on it. But again, Think, Talk, Treat Migraine. That's the name of our program. And again, it's I'm going to pass through the agenda because we sort of already talked about that. It's about unmet need in migraine. And again, once I started with Lilly, we actually had a directive from our CEO that he was wanting us to sort of transform how medical affairs works in the migraine space. And he wanted us to construct a program that was really about what we determined to be unmet needs in people with migraine and their care. And what we did is we took the data that exists right now about where people are falling through the cracks, where people are not getting the treatment or the attention that they need and they deserve, and how are we going to fix that? And it's nice that what we put together was a program that is completely not about any of our medicines. It's not about any medicines in particular, for that matter. It's not about any Lilly thing. It's really about getting migraine the attention that it needs. And here's the data that we use to determine what those unmet needs are. So, again, with full recognition that I'm speaking to a very, very savvy audience here, These are data that a lot of primary care doctors, and for that matter, even a lot of neurologists, don't necessarily know. And what we share with them is that 12% of the world, right? It's over 1 billion people in the entire world have migraine. Here's one that was actually news to me that I didn't recognize, is that nearly 30% of people in a primary care waiting room, no matter what they're there for, also have migraine. And so 30% of people walking in the door are people who are potentially at a point where someone can intervene and ask the right questions and treat the disease before it becomes a much larger chronic problem. A lot of us in the room are aware 37% of women, 18% of men have migraine. Interesting other data point here that when outpatients, so any outpatient, right? So people coming in the door to a primary care doctor with headache, right, as their main complaint, 94% of them actually have migraine. So these are the data that we use to kind of help determine what unmet need is. And this was another interesting set of facts that came out of a large study called Overcome, where we took data from tens of thousands of people with migraine and tried to kind of plot where their journeys kind of lead them from a treatment standpoint. So for every 20 people with migraine in the United States, only about 13 actually make it through the door to see their primary doctor about their disease. And then when we look at people who actually get the correct diagnosis, now we're looking at half, right? 10 of 20 people that actually make it in the door get the correct diagnosis. And you can imagine not having the right diagnosis means not getting the right treatment. Among the people who actually get a diagnosis, of 20 people who are eligible for acute medications, only 6 are getting it. And of people who are eligible for preventive medications, we're looking at only 3 out of 13. So there's a huge gap, a huge unmet need, if you will, in the treatment space. So high prevalence, unmet need underscore the importance of addressing migraine with providers. And you know, again, going back to a lot of other initiatives that have happened through the years, a lot of them are directed at providers. A lot of them are directed even at primary care. And I think we're all maybe a little bit too cavalier about wanting to turn primary care doctors into headache specialists, right? And that's not necessarily what they want. And it's not necessarily something you can do with a couple of hours of continuing education. So what we're looking to do is just activate the knowledge bases that we know that they have, right? They know the basics of treating migraine. The issue is that they're not asking necessarily the right questions all the time to activate that knowledge base that they know. And that's why working with people with migraine is such an important part of this as well, because in that situation, when you're working with a provider that doesn't get it or doesn't know, or maybe does know, but is just not asking the right questions, this is another opportunity for us to at least connect the dots. Right. This is more of a program that's about facilitating communication between providers and patients. So again, here's that slide. It's all about the 411, the four key symptoms: headache, impact, light sensitivity, nausea. The one key question, which is about impact. How much does migraine impact you? And then using that answer to determine, are you a candidate for acute therapy? Are you a candidate for preventive therapy? And when we think migraine, we need to think about the impact that it has on us. And again, I realize I'm speaking to a room that knows it better than anyone else, certainly knows it better than a lot of the providers treating you, about the impact to your daily activities. How much is it taking you off your game at work where you're not able to function at 100%? And that addresses the issue of what we call presenteeism, right? Chronic illnesses have a problem with absenteeism, where you just cannot function, you can't go into work. But it's also a problem of presenteeism, when people who are not at 100% go into work anyway, and they're just struggling to really do the work that they need to do. Light sensitivity, nausea, so many ways that we express impact, and yet we don't always express those things to our providers. And I know this coming from my end when I would ever talk to my patients, and I'd say, okay, how often is migraine impacting you? And the answer that I would get a lot is, well, I probably get, maybe 10 headaches a month. And I'm like, no, don't tell me just about the headaches. Tell me about the impact, right? When that headache is over and you're still not on your game for a day, maybe even several days after that headache has ended, those are days of impact, right? Those days where maybe your headache is mild, or maybe the other symptoms you have are mild, and they're not at that severe point where you're considering it a migraine day, but it's still a day where it's taking you off your game. Those are days of impact. And next thing you know, that number's gone from 10 to 20. And so it's so important to remember that it's not about the days of headache. It's about migraine, right? Migraine is more than headache. And migraine is about that, and the treatment is really about that impact. So it's important that all of us in the room ask the right questions and share the right answers to make sure that we're getting the treatment that we need. So when it comes to having 2 or more of these symptoms, there's a 93% chance that that person has migraine. And so that's the first unmet need we're looking at. People who don't even know they have migraine, people who think they just have headaches. And so again, this is not the people in this room. Most of the people in this room are aware they have migraine, but think of the millions and millions of people who are lost on this journey because they don't even know what they have yet. So where it does pertain to the people in this room, this is that question that I was asking about. The thing your provider should be asking is, how many days in a month does headache or migraine impact your daily activities? And if your provider doesn't ask that question, we need to be prepared to share that question even when it isn't asked. And again, very much preaching to the choir here about where that impact can take place, your work productivity, your home productivity, family activities, being able to do leisure and fun activities with your friends and family, and most importantly, sleep. Sleep is so important, and sleep is not only a major cause of some of that worsening that we see in migraine, right? Disruptions in sleep, disruptions in circadian rhythms, but is also kind of a part of the treatment as well. It's very cyclical how the two kind of go hand in hand. And yet again, sometimes that question doesn't even come up from our providers about how migraine is impacting your sleep. So be ready to share that, because those count as days. As far as what those important timeframes are, 1 day a month, and this is the information we're sharing with primary care. 1 day a month, we need to be thinking about aggressively treating acute or using acute migraine therapies with patients. And if patients are having more than 4 days of impact, then we really need to start having or at least being prepared to have the conversation about preventative treatments. And keeping in mind, remember, this is not about any product. So preventative treatments are not going to be the right answer for everyone at 4 days. Some people are going to need it with less. Some people are going to need it with more. Some people want to hold off for a little while, and that's okay. But we need to be prepared to have that conversation at least. And as far as the preventatives go, again, not endorsing any one product or not, or even any one device, but this is based on the consensus statement from the American Headache Society, and this is just the list of treatments that they have. You have a very long list of acute treatments, a very long list of preventive treatments. This was something I felt incredibly strongly about, that we can't have this program target providers and say, okay, here are all the treatments, and yet keep people with migraine in the dark about what is available to them. And it does make people very nervous sometimes to say, oh, well, no, we're going to give them the list of things that have evidence that work. But education is a very important thing, and it's important to kind of just pull the curtain aside and just get everyone on the same page so that People with migraine have the opportunity to know what's available to them, to get educated on those things, and to ask their provider if they're a candidate for it, and be prepared to have, good, thoughtful questions to determine which one is right for them. So that's why that was an important part of the campaign. This is not just on the provider side of our website, it's on the patient side of our website. There's so many reasons why appropriate therapy is important, not just the chance of alleviating symptoms and making people feel better in that moment, but also giving people the ability to function at the level that they know that they can function at, and then, of course, prevent disease progression from going from a situation where it's affecting someone several times in a month to over half the days in a month. We don't want that. So if we can intervene early, that's obviously the better way to go. So next steps, things that are important to take away today. If you have a medical appointment and you have headache that impacts your life, and again, I intentionally use headache here because this is for the populations of people that think they have headaches, right, and haven't yet realized they have migraine. So if you have headache that impacts your life, you need to ask our provider, what is the cause? Is migraine the cause of that headache? Again, knowing that if someone goes to a primary doctor with headache, 94% chance that it is migraine that they're dealing with. If you've been diagnosed with migraine and it impacts your life more than one day a month, you need to think about aggressive acute treatment. And if it impacts your life more than 4 days per month, we need to see if preventive treatment is really the right answer for you. And then when it comes to resources, our website is thinkmigraine.com. Right now, we're really focusing on four cities in the U.S. We're in Indianapolis, of course, that's where we're based, Raleigh, Durham, North Carolina, Denver, and Hartford. And we hope to expand in 2022 to 4 other regions, bigger cities. We hope that at some point this sort of approach will really get some traction and we can expand it to a nationwide program in the future. But the last thing that I need to share on here that is not on the slide is the criticism that I always get about wanting to talk to advocacy groups and wanting to be here at Retreat Migraine is that this is a group of people that is already very savvy. To some degree, most of you are expert at navigating the healthcare system and navigating your own disease. And so the question is, well, are these really the people that we're looking to reach? Even among this group, there's still some potential for us as a medical community to do better. And also, you're all advocates at this point, and you have a network of people that look to you and see you in your journey, and look up to you and say, okay, maybe I need to talk about my migraine, or maybe I need to think twice about whether my headache is actually a migraine. And that's really what this is all about. That's why working with advocacy groups for a program like this is so important, because of that connection to people who have not yet made it to this point in their journey. So there's that slide again. I just want to thank you very much. And of course, I'll always be so happy to answer questions. Thank you so much for your time.